I'm stepping into the division of pediatric surgery at a very unique time. Stepping in at a time where there's been tremendous growth before I even started. The trajectory is such that if the growth continues, we're poised to be one of the busiest pediatric surgery divisions in the country. In order to do that, we have to continue to have top patient care as the forefront and foundation of our division. That starts with getting the best people, and those best people include attendings, but also fellows. We want the very best fellows in the country, individuals that are curious, well-trained, technically excellent, and will be leaders in American surgery. In the future, I see WashU Pediatric Surgery being one of the top centers in the world, but first starting with being the best care for our patients of St. Louis, understanding that our best care in the world is not as effective if all kids of St. Louis don't have access to it.
So our Pediatric Surgery Fellowship is a 2-year accredited program in pediatric surgery specialty training. It's designed as an intense clinical experience to train our fellows in everything we can teach them about the practice of pediatric surgery as pertains to congenital disease, fetal therapy, as well as the broad range of general pediatric procedures.
Our program is wonderful in that you really get the whole breadth of pediatric surgery in terms of where on the body you're operating to the age range from a premature baby all the way up to an 18-year-old and all the different medical problems that they can develop along the way. You really get exposure to all of that, and as a previous fellow here, I know that you leave the program well-trained and prepared to take care of all those, the full spectrum of medical issues that you come across.
I chose Washington University in St. Louis for my fellowship because I knew I'd be well-trained here. It is an academic powerhouse that is well-known and it's well-deserved. Some of the brightest and best in the field are here. It's an innovative place that has a lot of resources to support our education. It's a hospital that attracts a lot of patients from different areas, which I knew would give me the opportunity to see a large variety of pathology. So when I would go out to practice, wherever that may be, I knew that I would be well prepared.
Well, I believe it's a really unique opportunity for any person that wants to do pediatric surgery. The combination of Washington University and St. Louis Children's Hospital is not found in a lot of medical centers. To have them sort of so close-knit and overlapping really benefits our fellows. I think we have access to world-class researchers, world-class clinicians, all on the same campus. There are a lot of children's hospitals that throughout the country are sort of isolated. They're not near an adult hospital, they're not near the medical school. We have the advantage of having all that on campus, easy access to a lot of people that are very smart and can help us out when we need it.
Part of being at St. Louis Children's is the fact that it is a quaternary care center, which means we're at the highest level of care in terms of everything being available. Transplantation, ECMO, heart-lung, all of this type of thing. Because of that, we are surrounded with expertise and available people from all different varieties of consultation expertise, all different varieties of background in terms of training. It's a very diverse group here. It's not that everybody trained at WashU and stayed at WashU. We have people coming from all around the country. Collectively, that allows us to really deal with very unusual things, and we see this all the time. And the nice thing about the depth of a place like Washington University and St. Louis Children's, the depth of science and knowledge is so great that there's usually an expert in every rare thing you can think of.
One of the things that I don't think people consider when they're residents thinking about fellowship is what the actual job on the other side of things is. And there are some programs that will teach you the technical things and how to do your job and how to take care of children and how to operate, but they may not be preparing you as well for the actual job on the other side of things. And I think this program does a great job of actually preparing you to be an attending pediatric surgeon. There's graded progression both in clinical management and in operative management and how you are managing the team that I think makes people very prepared. And I know that to be true actually because I trained here as a resident. This is my 10th year now, so I've seen 10 generations of fellows come through, and every single one of them has reiterated that exact point, that when they are done, they feel ready to do the job that is needed.
So a successful fellow is pretty simple in my opinion. Someone who prioritizes clinical care, someone who is team-oriented, and someone who builds trust amongst the team. So prioritizing clinical care means that we're here to operate, to take care of kids. You know, that's the first and the last thing we think about. So someone who comes into our program with enhanced skills, comes out of our program with refined skills. But also that clinical care comes with judgment. A successful fellow is someone who learns when to operate, when not to operate, who learns when to ask for help. And finally, the successful fellow is someone who's a leader and a teacher. You know, someone who demonstrates leadership throughout the fellowship, who thinks about different ways and improvements in clinical care. Someone who leaves processes and improvements behind and making our fellowship better after they're finished.
I think St. Louis is a great place to train both personally and professionally. I think professionally, it gives you a wide variety of pathologies that come in because people come to St. Louis to be treated. But I think personally, it's a place that has a lot for all different types of people, whether you have a family or you're coming on your own. There's something here for everyone. There's a great cultural environment here. There's a great food scene, and we're not too far away from outdoor activities. So really, whatever it is that you're passionate about outside of work and outside of fellowship, there's something for you to find here.
St. Louis is a really great balance of urban and rural, I think. We have a great cave system, river system. We're in driving distance to a lot of interesting spots, kind of up and down the Mississippi River. So St. Louis has been a great place, not only for the WashU environment, which is hard to beat, but also from a family perspective.
This is a place and an institution that values balance and supports our faculty, our fellows, our residents in having a life outside the hospital. That makes you a more fulfilled person, and in turn, that allows you to do better and provide your very best every day for your patients. I can't thank my partners enough for the times when they're willing to cover, to help, to rearrange schedules, to make sure that I can be there for the things that are important for my family, and vice versa. I really can't think of a situation in which any of us have needed help and not found it. We really have each other's backs.
I think the way that we try to train someone to make them better is that you try to instill in them a sense of care for the entire patient and the family. And so it's not just going to the operating room and learning how to do a specific operation, which is important. You know, don't get me wrong, the technical aspects of it are important. But you have to be able to take care of that patient the minute they're out of the operating room. You have to learn how to take care of the family who's part of that recovery process. And I think that that's a very important aspect of what we do. And so it's easy as a surgeon to fall back on just what you're doing technically, but I think if you're really gonna make someone better, take that next step, you've gotta instill their ability to care for the entire process from start to finish. You know, I think as a faculty member, as a training program director, I think I can speak for our entire faculty that we take that responsibility very seriously. You know, we like to have fun, just like everybody when we're working, but it's a pretty significant responsibility to train someone to take care of an infant or someone's child. And so I think you try to instill those values.
After training, you'll come away here with a family. You'll come away here with mentors, with people that'll support you, that will cheer you on, that will be there whenever you need help. And so that's really important because in pediatric surgery, there are cases that you might see once in a career, or you may see once every 3 to 4 years, and you may have not seen it while you're a fellow. And so being able to reach back to ask for help, assistance, guidance to handle these cases, that's definitely provided here.
I feel very prepared coming out of this fellowship that I could handle pretty much any situation that came at me, either like immediately or at least knowing like who to call and how to get the problem solved. And I think that over the course of the program, I have been mentored and coached and taught how to do that, not only in terms of the medical care and the operative technique, but kind of the multidisciplinary nature of children's care, the longitudinal nature, the interactions with other members of the team and the community. And so I think it's great comprehensive training. I wouldn't have traded it for anything.